It is not you shoving a whole lot of your poo into a bucket and sending it to the lab. No. Have you heard of the fecal occult blood test? Bowel cancer screening. Have you heard of that? Good day. I'm Dr. Tia, and today I am talking to you about bowel cancer screening. In Australia, this has recently been brought down to commence from the age of 45 because a lot of young people have been found to have bowel cancer. Now, this should ideally be discussed with your GP, but I thought I'll kind of demystify it. It is not you shoving a whole lot of your poo into a bucket and sending it to the lab. No. It is not. And I'm always intrigued because patients will talk about, oh, it's disgusting. But at least you know what you ate. Poo is just processed food, yeah? So, or maybe I'm too medical. I just see it as part of the human experience. And yes, it can have a smell to it, but in the grand scheme of things, I'd rather handle and deal with that than find that I've had cancer that was potentially preventable and it could have been picked up early. Anyway, I'll get off my soapbox. How do we do the fecal occult blood test screening? As a recap, a screening program is utilized when you don't have symptoms. We're not investigating anything. It just so happens we acknowledge you have a colon, or you have breasts, or you have a cervix. And the question is, are those happy? Are they working well? Are there any issues or not? That's what a screening program is. So if you're ever like losing blood with your motions, having mucus in your poos, you're losing weight, or you have any other bowel concerns, that's not to be addressed through the screening program. That is to be addressed with your doctor. So a screening program, you get a love letter in the mail saying, congratulations, happy birthday. You have now reached the threshold that says you need to have bowel cancer screening. Bowel cancer can be a reality for you, and we thought we would check in. So you get a kit that has things like this. These are little bottles, and you get 2 of them. If you are getting a cancer screening from the lab, you might get 3 of them, but basically you get a kit like this. It has a bit of liquid at the end there. Yeah. So you do this, and we do bowel cancer screening every 2 years until the age of 74. And it basically checks for blood in your motions. Now, blood in the motions can be something that happens and it's benign. It can be that you're a bit constipated, you have an anal fissure, or you have a hemorrhoid, or something else non-sinister. But blood in the motions can also be a sign that you have bowel cancer. So if we did this and we picked up that there is blood in the motion, even though we know it could be something benign, we have to go the whole 9 yards to make sure that it is not bowel cancer. So this is the whole point of the bowel cancer screening. So you would take the lid off. No, before you take the lid off, you would write your name before you go and do number 2s. When you're like, I'm doing it, I'm starting the process. Write your name on here, the date as well. And you'd put a lot of tissue in the toilet and then do your number 2 business. Hopefully with the tissue, it means things are not sinking down to the bottom. And then you would open the lid. So the lid has this green attachment, as you can see. Yeah? So with that green attachment, you poke the poos. The ones that are sitting on the toilet paper, you just poke them. You do not need to shove them in here. No, you poke and you put it in here. You seal it shut. You put it in the fridge, and 2 different poos on 2 different days, ideally back to back, so that this is not sitting waiting too long in the fridge. So you would put it, you'd put it in your bag, yeah? Put it in the fridge. Next time you go and do number 2s, you do it again. So in the grand scheme of things, only the stick here touches the poo. Just a stick. It has a bit where it's jagged, so that whole thing needs to be kind of touching the poo. And then Ta-da! Congratulations! You've done part 1. You do it again, you send it off to the lab, and they send me a love letter saying, Jerry is fine. And I put a reminder for 2 years to check how Jerry and his bowels are going. Come on, guys. I have a lot of patients who come in and yeah, I received it. It's in my bathroom. Yes, I received that kit. It's in somewhere else. Oh, I keep misplacing it. This is the face. This is the face. Just do it. There's 4 cancers that we are actively screening for in Australia: lung cancer, breast, cervix, and bowel. All the other cancers, brain cancers, we don't even have a way to check if you're going to have them before you have them. Please do it. Till next time. Bye.